The discovery of a lump in the breast is a very common symptom. It spans all age groups and understandably results in a significant amount of apprehension. How does one deal with such a symptom? Remember, all lumps are not necessarily malignant. In fact, the majority of them eventually turn out to be benign or non-cancerous. Also, in a small percentage of individuals which do turn out to be malignant, the earlier the detection, the better the cure. In such a situation, the most sensible thing to do is have it checked by your doctor. When evaluating a lump in the breast, the following issues need to be addressed. Firstly, what is the suspicion of malignancy? Is this a benign finding that only needs a bit of reassurance and can be left alone or simply kept under observation? And secondly, if there exists a degree of uncertainty as to the pathology of the lump and further investigations are required, then what are the tests that need to be done? Your physician will make an initial clinical assessment based on a detailed history and a complete physical examination. The most important factors in your history are your age and a personal or family history of breast or ovarian cancer. Although other factors like breastfeeding, age of first full-term delivery, age of menarche, your age of menopause, if you're menopausal, oral contraceptives, hormone replacement therapy, all of these are possible risk factors. They do not actually help to confirm or rule out the possibility of cancer. Your doctor will also perform a complete physical examination that will include checking the lump itself, the rest of the same breast and the opposite breast. He will also check regional areas like the armpits or the axilla and the lower neck. Based on his assessment, he will decide on the risk of malignancy. This flow chart summarizes the management of a lump in the breast. Like I said, based on the initial examination, your doctor will decide on the level of suspicion. If, for example, the woman is young, has no family history of breast cancer, and the characteristics of the lump on physical examination are suggestive of a benign lump, then often no further tests need be done and it can be simply kept under observation. However, if there are risk factors commonly associated with breast cancer like older age, a positive family history, or if there is a clinical suspicion of malignancy noted on examination, then further investigations are usually in order. And this is usually initiated by some form of imaging of the breast. Imaging modalities include ultrasonography, mammography, magnetic resonance imaging or MRI, and a PET scan. Of these, the first two are the ones that are most commonly advised. In a younger woman, an ultrasonography alone is often adequate, whereas a mammography or a combined sonomammography is the preferred type of imaging modality in older women. Based on the imaging report and the initial clinical evaluation, if the level of suspicion is low, the lump is simply kept under observation and no further tests are advised. In certain cases, a repeat ultrasonography or sonomammography may be advised after a relatively short interval, typically 4 to 6 months, and compared to the previous imaging to look for interval changes. If on imaging malignancy cannot still be ruled out, then some form of biopsy is mandatory. A biopsy is a technique by which suspicious tissue is extracted from the body and subjected to pathological examination. A biopsy is the only conclusive way to establish whether a particular lump is benign or malignant. There are different types of biopsy methods, each with its own advantages and disadvantages. I will be discussing the different types of biopsies in another presentation, but for now, this ends my presentation on the evaluation of a lump in the breast. I do hope you found this useful. Thank you.